My name is Karen Dolce. I'm 52 years old. Today is September 25th, 2015. We're in Sacramento, California, and I'm here with my son, Kevin.
My name is Kevin Leland. I'm 26 years old. Today is September 25th, 2015. I'm here in Sacramento, California, and I'm with my mother, Karen.
So, Kevin, gosh, it was 12 years ago, a couple of days before your 14th, no, your 15th birthday, a couple of days before your 15th birthday, and you had surgery. And you woke up from the surgery and couldn't move your legs. You were paralyzed as a result of the epidural that they use for pain control. And my question for you right now is, tell me about that time. What do you remember about those first couple of days?
The first couple of days were a little hazy. First thing I remember from the surgery was I was waking up in this dark room in a bed. I felt different wires attached to me, like EKG cables, the IVs, but I couldn't move at all. I just felt frozen, scared, alone for a couple hours. I remember calling out to the hallway, seeing if anybody would come and help me, but nobody came. After that, I blacked out again. I woke up in the emergency response room, no, the healing room, and you were right next to me. I don't remember exactly who told me that I was paralyzed, but I got the message, and it was hard for me to hear it.
Yeah, you were just 15.
Like 4 days away from turning 15. It was, at the time, I was just upset, and I just wanted something to get my mind off it for the time being, so we just watched movies. Later that night, they took us up to my own room, and I just remember a lot of people coming by, wishing me a speedy recovery, being there for me. Beyond that, I was very dizzy and hazy, but always so sad.
Sad. Yeah, you didn't really show. I mean, you were scared for a while, but you so quickly rebounded and wanted to get your life back and wanted to get on with your life. And you were just 15. How did you do that?
I looked around at some other people who had been paralyzed, and I had seen all the stuff they did before. And being sad all the time, I just got tired of it. I got tired of just sitting there, just waiting for something to happen to me to fix all this stuff, to fix what happened to me. So I just decided enough of waiting. Just find something to do, figure out what to do something to keep me going, keep going further.
About 3 weeks after you were injured, we transferred you to Shriners Hospital. Do you remember your first days and weeks there at Shriners Hospital?
My first days, I didn't really want to go. I didn't feel comfortable there.
Yeah, you wanted me to take you out.
You asked me to give it 3 days. Three
Yeah.
days to try it out. First day there, I met my physical therapist, Latasha.
Latanya, I think.
Latanya.
Mm-hmm. She was pretty amazing.
Yeah, she somehow knew how to spark me right up, how to make me feel better.
I think that's when hope started coming back for me. Their philosophy of, we hope you get everything back, Kevin, but let's work with what you have right now. Is that something you took with you? Is that something that you used to help get moving? I know they said that they were going to have you doing your laundry within the first week, and you looked at me and said, I just want to go back to UC Davis. I just want to go back.
They had some, there was something about them that just helped give me more motivation to keep going, to learn what I can do with my wheelchair, with my body the way it is. And it was exciting. They always knew how to make it fun, make it exciting for me. That's what made me want to go back for the next day of sessions, the next physical therapy lessons, the next skills they were going to teach me.
Mm-hmm.
helped me keep going.
I remember talking to a nurse because Shriners had both burn patients and spinal cord injury patients, and they said that they were, they mixed the patients together in therapy sessions. And, my heart was going out to the burn patients, and the nurse told me it's very interesting that the kids who are burnt will say, "Thank goodness I'm a burn patient. I think having a spinal cord injury is much more difficult." And then the kids who had a spinal cord injury would say, "I feel so lucky I have what I have, because it would be much easier in life to be burned. To have the spinal cord injury than to be burned." And how did you feel about that? Was there any time that you felt lucky, like uh, this person has more difficulty than I do, and I'm lucky to have what I have?
No, I didn't really feel lucky at all. I mean, we were all in there to be helped for with our own individual problems, but they were both problems nonetheless.
Mm.
So I didn't really feel lucky that I was a spinal cord, not a burn patient. It was difficult on both ends.
So, right out of the hospital, you went straight back to high school. Was that scary?
It was starting out. I mean, seeing everybody's reaction to what happened to me, how I was going to get around the school. Part of me was afraid of how they would treat me, if they would treat me differently.
And what happened?
Over time, they did treat me a little differently at the beginning, but as time passed on, they still saw me as how I was before. They didn't treat me the same way I was before I went to the hospital and got paralyzed.
Do you feel like you've missed out on anything in high school because you were in a wheelchair?
No, I still got to go to each class, still got to actually participate in gym class. I actually got to go to the senior field trip
Yeah.
all the way to Disneyland. I didn't miss out on anything. I still got to do everything I could.
So, that first summer when you were out of the hospital, you went to school for a couple of weeks, and then it was summertime, and we decided to send you to Wave Camp.
Yes.
Remember that?
What is Wave Camp?
Wave Camp in as the Sacramento area, an abilities group does at Sac State. They have a week where folks with disabilities, children, go and do all kinds of sporting activities. What did you do that week?
I did fishing, water skiing, scuba diving, and just regular swimming in a pool.
Mm-hmm.
We had like a few water gun wars. That was a lot of fun.
Do you remember when I dropped you off? What happened?
I did not want to go there. I didn't feel comfortable at all. And then I met my, each camper there has a counselor who sticks with them, who helps them out. One of the counselors came up to me and said he needed my help because each kid chooses their counselor by blasting him with a water gun.
And what did you say to me?
First, as soon as I heard that, I looked right at you and said, "Bye, Mom."
And I didn't hear from you for a week. And then you went to another camp. What was the second camp you went to?
Camp Womp. That was a camp all the way up in the mountain area.
Mm-hmm. No roads, no trails.
No trails, just nice little campground right next to a lake. There was lots of activities there. There was arts and crafts. There was bit of hiking, swimming in the lake, archery a couple times.
Fishing?
There was fishing. Didn't catch many fish that time.
Mm-hmm. And then we sent you one more camp.
It was a snow camp.
No, there's one more that summer. I think that was in cabins.
Oh, yes, I remember that one. It was at a cabin ground. Same principles, both like a wave camp.
Mm-hmm.
But there was other activities too, nature walks, viewing all the animals.
What lessons did you learn from these camps?
I can still have as much fun in a wheelchair that I did when I was walking.
Do you remember what you said to me when you came home from the third camp? It's okay, Mom. You don't have to send me to another camp.
I get it.
And
I
what
get
did
it.
you get?
My life is not less, it's just different.
And were you limited?
No, I was only limited by my limitations put by myself. I could do anything as long as I put my mind to it.
So, how have you used that? So, you've graduated from high school, you have some college. Tell me how you've used that, and you're working full time. You're pretty darn independent. How have you used those lessons?
Whenever I come across a problem, I just think of another way to do it. It could be as simple as just finding another way to a place, or learning a new computer tech problems for work, or how to handle one of my co-workers that I don't see eye to eye with, or just finding what other skills I could use for the future in my job or in life.
So, what do you think your biggest challenge today is? You're in a wheelchair.
Honestly, I don't see any more challenges. The only challenge I have to deal with on a daily basis is just a harsh reminder
Of?
of what I lost. Every day I have, could be in the morning, could be while I'm eating lunch, or it could be when I see something on TV when I come home. I get a harsh reminder that I got paralyzed due to an accident. And I take my time to grieve about it, to let it sink in. And then I realize that I may have been paralyzed, I may have had an accident, but I'm still here. And I've done a lot. I've done so much. And even though it hits me every day, I wait for it to hit, and I just take my time to grieve, dry my tears, tell myself, time to get going, time to show everybody that I'm a happiest person alive. I can still keep going.
I didn't know that you thought of that loss every day.
Every day it did hit me, but I won't let it slow me down. Won't let it stop me.
Do you sometimes pretend to be happy to make me more comfortable?
In the beginning, I did. I remember how sad you were when you found out that I was paralyzed. Starting out, I pretended to be happy, even though I was somewhat miserable from the paralysis. But you're always there to help me feel better, to help me think of a way to make things better. So I opened up a lot more. Nowadays, I always tell you how I'm feeling. If I'm feeling down, I don't hide it anymore.
Good. I'm glad to hear that. So, we've been through a lot together, and we continue to have our adventures in the hospital.
Yeah.
You're incredibly brave. You have such a wonderful personality. I've never, a nurse will come in to do an awkward procedure, and you'll greet her with a smile and say, "How is your day going?" And I've seen a couple of nurses just stop in their tracks and be amazed by somebody asking in a hospital bed who's hooked up to all these machines, who's clearly uncomfortable and sick, asking them how their day is. And I think that's pretty incredible, that you care about other people and you want them to be comfortable.
Dad always taught me to treat people the way you wanted to be treated. And I took that to heart. I mean, I always wanted to be treated with respect, so I give respect to everybody. And I get it in return, and it feels great to treat people that way, to be treated back to them.
What are your dreams, Kevin?
A couple of years ago, I wanted to get a full-time job. Now, I think my goal is to actually become a commander of a post in the California Highway Patrol. I'm an office assistant now. I'm qualified to promote to an office technician. I think my goal is to become a commander of any kind of section to California Highway Patrol.
That's pretty great.
I can do it. I just got to set my mind to it, make a plan, and see it through.
That's great. Do you have questions for me about?
How have you handled it over time with how I've got paralyzed?
It's hard. You want your children to be happy, first of all. And I see that you're happy. You're probably one of the happiest people I know. You're always just genuine and generous and loving. And it takes very little to make you smile. You're kind and you're generous, which is wonderful. So I try not to focus on the things that you don't have and what's not available to you, but I look at the important things. But it's a huge loss. I just want you to have all the opportunities in the world and all the options in the world, and you choose. And there are some options that are not available to you. And I don't know how early we came up with life is not less. It's just different, but that's what we have to live by. And it helps get through the hard times.
It has.
So, what's one of the proudest, what makes you proud? What's one of the proudest moments that you've had in the last couple of years?
But I'm actually working a job that helps not just what few people, helps everybody. I work for the state. I work for a law enforcement agency. The fact that I'm working side by side with officers and civilians that are helping to make the state a safer place to live, that makes me proud. My job, some people may think my job is pretty small because I'm just an office assistant, but I've learned that every little job helps. Even the smallest little details can make a difference.
That's great. What have you learned? What's most important to you?
To not think less of myself. To make the best of everything I got, everything I have, and everybody who's in my life. You, Dad, Megan, Grandma, everybody who's been there for me. You've always had a lot of faith in me. And I want to keep proving you guys right.
I guess I probably asked this before, but big lesson? If you were able to talk to somebody who was just paralyzed or just had great loss in their life, what would you tell them? Being, was this 12 years?
12 years next year in March. You take loss is hard. The important thing is not to hide it. If you just bury it deep, it just hurts even more. Let out your sorrow, grieve for the amount of time you need, then find a way to cope with it. Find something that makes you feel happy with that loss.
Do you remember the first things that started to make you happy?
LaTanya, my therapist, the camps, they helped me adjust.
The Three Stooges?
That was true too. Whenever I just needed to laugh, I watched Three Stooges. Helped take my mind off the sorrow.
Do you have any dreams that, do you remember being, 14 and having dreams about what you thought your life would be and that those are different today?
The only dreams I had of when I was 14 was just those feelings of walking again. I never really thought about what I would be like if I was still walking. Maybe I'd still be, maybe I would have gotten to the CHP either way, or maybe I would have found a different career. I've never really had dreams like that. Sometimes I just have dreams about using my legs again,
Mm-hmm.
but that was as far as I ever got. Never
Mm-hmm.
what career I would take or what direction I'd go in life.
Do you think about the future a lot?
On occasion, I think about what's my next step in my career, girl, or what will happen one day when I suddenly get more sensation. 6 months after I got paralyzed, my hip flexors suddenly started to kick back in. I could actually twitch my hip flexors, and if I laid on my side, I could actually move my leg, slide it across. And actually, a year later, one of my thigh muscles I was able to clench it, twitch it. So I always think that there may be just another possibility that some other muscles might actually spur back to life.
So you do have hope that you'll move your legs again?
I always do. I believe that anything's possible. I believe that someday it may happen. Until then, make do with what I have.
You talked a little bit about still continuing to have hospital visits and procedures. Could you explain a little more?
One of the drawbacks of being in a wheelchair is you run the risk of getting pressure sores from sitting all the time. And I have been admitted to the hospital with pressure sores where I'd actually have to lay on my side and have to have plastic surgery to close the sores and stay off it for 3 weeks.
Or 6 months?
Yeah, 6 months in my own bed, not standing up. That was difficult. On occasion, I go in for infections because I'm taking a medicine that helps keep my body healthy, but also suppresses my immune system a little bit. So I occasionally go back in for infections. But we've learned how to expect them, how to see them coming. My body reacts a certain way. If I start to get an infection, I get elevated heart rate, headache, and dizziness. Once we get those 3 symptoms, straight to the hospital for antibiotics and fluids. And on more than one occasion, we caught them early. Going back to the hospital is a bit of an inconvenience, but it's well worth it to keep me from staying there for extended periods of time.
What is it like to live with your family?
It's a joy to live with them. They're always happy. They're always finding good stuff to do. On top of that, they have a lot of animals. We own a small property with a bunch of farm animals and dogs as well. Living with them, it always keeps me happy because they're always happy and they're always trying to keep me happy. And they're always there for me in case if I ever feel down, or if I just need some advice, or if I just need someone to talk to, just to have someone there for me.
In your Manny flat.
Yeah, my Manny flat, man cave / granny flat.
There you go.
If you were to recover sensation in your legs, what is one thing you would do?
Well, if I did, I would try and keep moving it, keep flexing it, then maybe find some way to get some therapy to see if it will work again. See if I can expand upon it. If not, just keep flexing it every day and pray for more to come.
So, if there was an experimental treatment or there was some therapy, would you be willing to do that? Take a risk to get your leg movement back?
That thought has crossed my mind a lot. Truth be told, I'd rather not take a huge risk. I mean, I've gotten used to my life the way it is. And I just feel normal. I don't feel any different. I feel like this is my normal life. I do miss the sensation of walking, like being able to feel my feet, feel the weight of my whole body on them.
Mm-hmm.
But given the choice, I think I might stay like this because I feel great. Despite what's happened to me, I still feel great in life. Still feel great with what I am and how I am.
Is there anything you regret?
In the beginning, I regretted taking that surgery that paralyzed me.
It was hardly a choice. You were so sick.
Yeah, I was. Part of me regretted it, but another part knew that if I didn't, I'd be sick a lot longer. I'd still be dealing with that problem.
Why did you have that surgery?
I was bleeding internally. Part of my intestines was infected with a disease that caused me to bleed internally, caused me to stay at home a lot because I was so sick. The procedure was to remove those infected organs so they wouldn't bother me anymore.
Yeah, you were on really large doses of prednisone, which was really hard to take. And you can't really stay on it for very long.
No, over time it started to cause more damage than healing abilities. So one day I got fed up with the sickness I was having in the middle of school.
Mm-hmm.
I just told my mom, I want to do the surgery. I want to solve this problem and get it out of my life. So initially I did regret it, but now that I don't have it anymore and I don't have to suffer that pain anymore, I feel better.
So, do you want to get married someday and have children?
Yes, I do. I want to start my own family.
When in your life have you felt most alone?
In the beginning of the whole thing, the few days after I woke up from the surgery that got me paralyzed, I knew there were other people who were paralyzed. I've seen them beforehand. But I just felt so alone because nobody else in my family knew what I was going through, what this sensation was. It was hard to live with.
Do you feel different? Different than somebody else?
No, I don't. I feel like just another normal person in the world. I may have to do a few things a little differently, but I still feel like a normal man.
So where will you be in 10 years?
10 years from now, I'd say I would have a wife, a couple kids, and I think I'd be probably a sub commander of a section from the CHP.
How about in 20 years?
Definitely a commander. Probably have another kid. I've learned that I can do anything. I just need to tell myself I can do it, make a plan, stick with it, and never be afraid to ask for help. Because everybody needs help once in a while with something, or more often than others. But there's no shame in asking for help.
What would you tell a 14-year-old boy who is just paralyzed?
It will be hard in the beginning, but over time, you'll develop your own skills, your own ways of handling things, and you will get better. You will have a good life. Maybe may not be the life you wanted or expected, but you can change it, but you can make it good.
How would you advise him or her to deal with anger?
Talk to somebody. Find a good friend to talk to, or just let out what you're feeling. Don't hide it. Eventually, you just get angrier and angrier from keeping it all in, to the point where you might actually say something that could hurt another person's feelings. Speak to somebody. You can't take on everything alone. You gotta have somebody there with you, or find somebody else. Find somebody to help you.
Remember what we say about an elephant?
How do you eat an elephant? One bite at a time.
Right. One problem at a time, one bite at a time.
Is there anything else you'd like to say today?
A lot of stuff I've said today I haven't really ever told you about this, Mom. About the dealing with sorrow every day. Partially was I didn't want to see you cry over this. But I'm actually glad I got to tell you this. You've been there throughout everything, all the hardships I've been through. You're always there to squeeze my hand whenever I felt mad or sad. Thank you so much.
Of course. You're my favorite guy in the whole world. There's nothing that I wouldn't do for you. I love you very, very much. And I'm very proud of you, of the man you've become, and the journey that you've embarked on, and how positive and wonderful and joyful you are to be with.